Hi, Tam here. So I was talking with some friends of mine, fellow doctors, and there's things that are a little bit annoying for most doctors, with regards to COVID-19. Number one, the COVID-19 reported death rate. Number two, the COVID-19 diagnosis at death. So number one, the COVID-19 reported death rate that we see on TV, There is no death rate that is accurate right now. So it's actually pointless right now to even talk about death rate, Say you have 1 million patients diagnosed as COVID-19. Of those, 10,000 die. Your death rate for the disease, for COVID-19, is then 1%. But if you have 10 million people infected and only 10,000 people die, then your death rate has just dropped to 0.1%. And that's the thing, the death rate is dependent on the number of people that we test. So if you don't test enough, if you test little, if you test a small group of people, then obviously your death rate is going to be exaggerated. The number of people infected, it's a completely subjective number. So now we've tested in one particular country, let's say the population is 100 million, but we've only tested 1 million people. And the COVID-19 number of death is 10,000. So we say that the death rate is 1%. But now if you buy more tests, if you manufacture more tests, and if you test much, much more people, like Germany is doing, and all of a sudden, a week later, we realize that the number of infected is 10 million people. But the number of deaths stays the same, it's 10,000 people. Then we know now that, but actually no, the death rate of the disease is 0.1%. So it doesn't make sense to talk about death rate, the number of people infected versus the number of people who have died, like I see on TV all the time. It's pointless and it's just fueling the panic, in my humble opinion. Number two, the diagnosis of COVID-19 as the cause of death. Now, I'm going to give you the example of influenza. If I get a patient, 72-year-old female, who comes and she says, you know what, I was actually great yesterday, but this morning I woke up tired, lethargic, fatigued, runny nose, cough, fever, joint pain, and all that stuff. When I cough, I've got this severe burning in my chest. I've noticed a lot of foul-smelling, dark green sputum. When I cough, it's a productive cough. I examine her, I do some tests, and she's influenza positive. So I say, okay, let's do a chest X-ray, because I'm not happy about this cough, and when I listen to your chest, I can hear some crackles and stuff. I do a chest X-ray, and she's got a severe pneumonia, right? Patchy consolidations in both lungs. My diagnosis is now multilobar pneumonia. I admit her, and off she goes to the medical ward under the care of an internist. So the diagnosis is lobar pneumonia. Whether the lobar pneumonia was caused by a severe form of influenza, maybe H1N1 severe attack, or she already had pneumonia, pneumonic changes in the chest, And now because she got influenza, things just accelerated and she became sick, we don't really know. But one thing for sure is that if you come and see me today in the ER and you tell me that, you feel a bit short of breath, you've got this terrible cough, you've got this foul smelling, dark green sputum coming out when you cough, maybe even a little bit of droplets of blood and all that stuff, and I do a chest x-ray and I do some tests, and your chest x-ray is a clear multilobar pneumonia, your PCT is high, your CRP is high, blah, 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 blah. My diagnosis is pneumonia, multilobar pneumonia. I must do a culture, I must put you on IV antibiotics and all that stuff. If you deteriorate even further, the shortness of breath gets even worse, and now you get, a pulmonary embolus maybe, and you end up in ICU, intubated some few days later, and ultimately, and unfortunately, you die. The patient dies. What is the diagnosis on the death certificate? And usually there is 1, 2, and 3. There's 3 lines. Diagnosis number 1, number 2, number 3. So she died of respiratory arrest, after intubation and resuscitation, but everything failed, and now she's dead. My number 1 diagnosis will be cardiorespiratory arrest as the immediate cause of death. And then number 2, I will write lower respiratory tract infection. Or if it's food poisoning. Or if it's a traumatic accident, I will write, a stab wound to the heart or a gunshot to the abdomen or whatever. And then number 3, I'm going to write the third possibility in that decreasing order. So number 1, cardiorespiratory arrest or cardiac arrest or respiratory arrest, or Number 2, lower respiratory tract infection. And then number 3, I might write pulmonary embolus or exacerbation of COPD. But I'm not going to write influenza. The only reason why I would write influenza as the cause of death, and sometimes influenza is truly the cause of death, the primary cause of death, is if I get a person that was otherwise feeling great and completely healthy, let's say yesterday or the day before, and then comes to the ER and tells me that, I'm sick, I've got flu symptoms, I've got joint pain, I've got this high fever, I've got this runny nose, I've got this dry cough that's not going to go away, and I'm feeling miserable, And then I said, okay, these are symptoms of the flu. I do a flu test, you're influenza positive, right? I do a chest x-ray, the chest x-ray is completely clear. No signs of pneumonia, no pneumonic changes, no other respiratory illness visible on x-ray. So I said, okay, so that's a severe influenza, because it's within 48 hours. I put you on oseltamivir, 75 milligrams twice a day. But your fever is just so high, maybe it's 40, 41, and you look just so sick. So I make the decision to admit you for observation, maybe IV fluid and stuff like that. So I admit you in the ward, and then you deteriorate further, and then you die. Clearly, you died of influenza. The primary cause of death will be influenza. Well, it will be cardiorespiratory arrest or cardiac arrest or respiratory arrest, but number 2 will be due to influenza. And then number 3, there's no need for number 3 if there's no number 3, right? So that brings me to COVID-19. How do people diagnose COVID-19 as the cause of death? A lot of healthcare workers are actually overdiagnosing COVID-19 as the cause of death. To be honest with you, in a lot of cases, speaking to many of my friends who are also doctors, in many cases you find that, you've got patients who have multiple comorbidities, and your typical example is your 76-year-old male patient who is a non-COPD patient, chronically on corticosteroids, still smokes, and on top of that, has had 2 heart attacks in the past, multiple stents in his heart, maybe a coronary bypass 20 years ago. It's hypertensive, it's got hypercholesterolemia, hypertriglyceridemia, so this guy is already quite sick and picks up a pneumonia. And he comes to see you into the ER, in respiratory distress, and you do a chest x-ray and he's got clearly a pneumonia, But because of the COVID-19 pandemic, we do a COVID-19 test and it's COVID-19 positive. All of a sudden, for some doctors, the diagnosis is no longer exacerbation of COPD due to a pneumonia. No, the diagnosis now is COVID-19. And when the patient dies, on the death certificate, they will say COVID-19. And when they report the death, they report it as COVID-19. And I think, this is just inflating the numbers unnecessarily. There are a lot of people who die of other diseases. All these other diseases are around, one of my good friend, who is an internist, was just telling me the other day that magically now, there's so much less people dying of complication of COPD exacerbation due to lower respiratory tract infections, pneumonias. But much more people dying of COVID-19. What I'm saying is that most patients in hospital at one point are going to be COVID-19 positive. You're in a hospital. It's a biohazard environment, a very dangerous environment. Nosocomial infections have been occurring in hospitals long before COVID-19 and all that. It's very real. There's many cases of people who are a little bit immunodeficient and they go to hospital and they pick up nosocomial pneumonias in hospital. Hospitals, unfortunately, are very dangerous. So just because somebody who came in with a lower respiratory tract infection or an exacerbated COPD or a severe viral bronchitis that has now deteriorated further into some severe respiratory distress or a pulmonary embolus or anything else, and they get diagnosed as COVID-19, and then they die of the disease they're being treated for, does not mean that the diagnosis at death should be COVID-19, and you forget about everything else. It's no longer pulmonary embolism, it's no longer COPD, it's no longer congestive cardiac failure, it's no longer, it's just COVID-19. And this is a bit annoying because this is just inflating the numbers and it shouldn't be like that. Cheers.